All right, everybody, welcome back to day 2 of this week-long Nurses Week giveaway. Today's giveaway, I think almost everybody will want to enter, even if you're not a nurse. It doesn't even have anything to do with nursing, but it's a special treat that I can give you guys to help you get through your week. Now, before we get started, like I said, what's a Nurses Week giveaway without a little education, especially because this YouTube channel is all about educating the next generation of nurses and the current generation of nurses. So first, before we get into the giveaway, let's talk education. Today, I am calling Focus Friday because this is a very important topic that not a lot of people know how to do. It's talked about in nursing school, it sometimes is talked about once you're on the job, but a lot of the time you kind of just try to figure it out, hoping you're doing the right thing. So for today's video, we are talking about crisis intervention for those violent patients that you may have. I found this really amazing PowerPoint created by a doctor called Crisis Intervention in Dealing with Violent Patients, De-Escalation Techniques. So that's what we are going to be briefly discussing before we get into this giveaway. So first, let's identify the signs of a violent patient. These signs could consist of black and white thinking, mutism, inappropriate laughter, fear, crying, blaming, yelling, and mutism. So secondly, let's talk about what you do in response to that, because that's where a lot of people get tricked up. This PowerPoint created by Crystal Pope, who has her PhD, says, give 2 arms length of space away from this patient. Turn your body at a 45-degree angle. You do not want to stand straight towards this patient. Also, do not block the exits of the room. You also want to reflect what you want your patient to show you. So be that mirror. Be calm and respectful. Also, do not have that defensive posture. Don't stand there with your arms crossed, your hands on your hips. Simply just have your shoulders relaxed and have your arms right in front of you. And do not have an aggressive tone. You want to have a normal toned voice. Now, the techniques to help you get through this violent patient crisis would be use active listening. Repeat back to the patient what they just said so they know that you are hearing them and understanding them. Be very concise with what you are saying. You want to use reflection questions as well. That is another technique. And you can do one-to-one verbal communication. So that means when somebody is getting aggressive, of course, if it's safe for you to be alone with this patient, or don't have too many people in the room. When too many people rush into the room, this patient could get even more violent. And lastly, what can you do to help this patient get through this crisis that they are having? Have them do deep breathing, 5 to 10 breaths in the nose and out the mouth. That helps greatly. Also, mindfulness, grounding, and body awareness are also great techniques for this patient to use. All right, now that we are done with that, let's get into today's giveaway, and that is a $30 gift card to Starbucks. I will personally mail you this gift card to Starbucks. So, how do you enter this giveaway? You are going to subscribe to my channel, you are going to like this video, and you are going to comment your name in the comments section below here on YouTube, telling me, if you want to, why you want this Starbucks gift card. But really, I just need your first name and last initial. I do not need your full name. But that is it for today's video, everyone. thank you for tuning in and thank you for being here on my channel. I am so excited about the rest of the giveaways. They keep getting better and better. Even though yesterday's Bala sneaker giveaway was pretty amazing, but I promise you the rest of them do get better as well, especially the 7th day. That is like the big kahuna giveaway of Nurses Week. All right, that is it. I will see you tomorrow in day 3 of this Nurses Week giveaway. Have a wonderful night, everyone.